In this video, I'm going to discuss the possible side effects of enalapril, which is a medicine used to reduce high blood pressure and to prevent or treat heart failure. If you have high blood pressure, taking enalapril will help prevent a future heart attack or stroke by helping lower your blood pressure and making it easier for your heart to pump blood around your body. So by using the manufacturer's clinical data, I'll categorize the side effects so you have a clearer understanding. So let's start with the very common side effects such as dry tickly cough, feeling dizzy, blurred vision, nausea or feeling sick, or generalized physical weakness or a lack of energy and strength. And what are the common side effects? Depression, fainting or passing out, an abnormality in taste such as decreased ability to taste or a noticeable metallic taste, chest pain like angina, or heart rhythm disturbances like tachycardia, which is an increased heart rate, hypertension, including orthostatic hypertension, which is a form of low blood pressure that might cause dizziness, lightheadedness, or fainting when rising from sitting or lying down, headaches, shortness of breath or difficult or laboured breathing, diarrhea or abdominal pain, fatigue, and your doctor may also see changes in your kidney function blood test results such as hyperkalemia, which is a raised potassium level, or increases in serum creatinine. So what are the uncommon side effects? These include anemia or hypoglycemia, which is an abnormally low level of glucose in your blood, which is less than 4 millimoles per litre. Diabetic patients treated with oral anti-diabetic agents or insulin should be told to closely monitor for hypoglycemia, especially during the first month of combined use. You can also get confusion, nervousness, or even insomnia, which is a common sleep disorder that can make it hard to fall asleep or stay asleep. Or the opposite might happen and you feel sleepiness or drowsiness. Or the feeling of tingling, numbness, or pins and needles. Tinnitus, which is a ringing sound in the ear. Flushing or flashing. Runny nose, sore throat, and hoarseness or asthma-type symptoms. Vomiting. Stomach discomfort, indigestion or a peptic ulcer. Constipation. Anorexia. Dry mouth. Excessive or abnormal sweating with no apparent reason, itching or a mild red raised rash, alopecia, muscle cramps, impotence, fever, and your doctor may also see changes in your kidney function blood test results such as hyponatremia, which is low sodium level, or an increase in blood urea or proteinuria, or even renal failure. Now, rare or very rare side effects include the whites of your eyes turn yellow or your skin turns yellow. This could be a sign of liver problems. Or you look paler than usual, feel tired, faint or dizzy, have signs of bleeding like bleeding from the gums or bruising more easily, or sore throat and a high temperature, and get infections more easily. These could be signs of a blood or bone marrow disorder. Or you have severe stomach pain that could reach through to your back. This could be a sign of an inflamed pancreas. Or you have swollen ankles, blood in your pee, or you're not peeing at all. These could be signs of kidney problems. If you have swelling of your face, eyes, mouth, lips, tongue, throat, or to your legs, feet, or hands, swelling is a sign of a condition called angioedema, and it can be dangerous if it affects any part of your mouth or throat. If you have this kind of swelling in your face, mouth, or throat, you should get medical attention right away. It has been reported that black patients receiving ACE inhibitors like enalapril have been reported to have a higher incidence of angioedema compared to non-blacks. Patients with a history of angioedema unrelated to ACE inhibitor therapy may also be at increased risk of angioedema while receiving enalapril. And your doctor may also see changes in your blood test, such as a low number of white cells or a low hemoglobin. You may get dream abnormality or sleep disorders, nasal congestion, a runny nose, sneezing and itching, Raynaud's phenomena, sore throat or mouth ulcers or inflamed tongue, a skin disorder such as erythema multiforme or Stevens-Johnson syndrome, or enlargement of one or both breasts in males called gynecomastia. It is also possible to have a serious allergic reaction to enalapril. Now, what are the long-term side effects? Taking enalapril for a long time can sometimes cause your kidneys not to work as well as they should. Your doctor will check how well your kidneys are working with regular blood tests, usually every year. Now remember, these are not all the side effects of enalapril, but what have been reported either during clinical trials or data collected after the drug has been marketed. Every person's body is individual to them and can react in different ways, so there could be other side effects that you suffer from and have not been reported yet. Now, if you are concerned about what we have discussed in this video, please contact your healthcare provider. And finally, 4 key facts to consider about enalapril. Your first dose of enalapril may make you feel dizzy, so it's best to take it at bedtime. After the first dose, if you do not feel dizzy, you can take enalapril at any time of the day and try to take it at the same time every day. Fact number 2, some people get a dry, tickly cough with enalapril. Fact number 3, if you get severe diarrhea or vomiting from a stomach bug or illness, tell your doctor. You may need to stop taking enalapril for a while until you feel better. These are part of the sick day rules. And number 4, drinking alcohol with enalapril can make you feel dizzy or lightheaded. I hope you found this video helpful, and if you have had any experiences with enalapril, please share them in the comments below. And don't forget to check out my other videos and playlists for more insights on health and wellness. Thanks for watching and take care.